Hey everyone, it's Dr. Jason West, private practice of the West Clinic in the booming metropolis of Pocatello, Idaho, coming at you with 100 years of healing with what's called a clinical short. A clinical short is a quick clinical pearl on a complicated healthcare condition because one of the people that's important in my inner circle said, hey, what can you do for interstitial cystitis? So for those of you that don't know what interstitial cystitis is, it's a chronic condition, a chronic problem of the bladder, and it is painful. It's no fun. Usually there's a little bit more prevalence in women than in men, at least in my clinical experience. And the medical treatments for it is antibiotics, steroid therapy, pain reliever medicine, and a lot of times it doesn't work for people. Now, some of the conventional alternative medicine treatments don't work for people either, leaving people in a horrible situation. Now, interstitial cystitis may be helped with the following regimen. And again, every patient is different. There's no such thing as an interstitial cystitis protocol. There is a treatment for Jerry and for Jane and for Jason and for John and for Carter and for Max. I mean, if you treat people, you get good outcomes. Don't treat their disease. That being said, let's go through a couple options and considerations for the treatment of interstitial cystitis. So with this debilitating problem, it's my experience, most of the time there's some type of chronic infection that isn't necessarily showing up on a normal interpretation of a complete blood cell count with the autodifferentiation. What this means is there's infections that can be occurring that the immune system isn't responding to. And how you pick this up on a blood test is if your white blood cell count is exposed to an acute infection. What occurs is the white blood cell count goes up. All of the guys are fighting something. With a chronic infection, or what they call subclinical infection, excuse me, is the white blood cell count will stay the same or go down, and the percentage of the white blood cell counts, the neutrophils which fight bacteria or the lymphocytes that fight viruses, it'll change. And a lot of times with interstitial cystitis, we have a subclinical viral infection, either herpes simplex 1, which is a cold sore virus, or the chickenpox virus, and literally the thing that causes shingles. And I've often wondered, is it shingles of the bladder? That's a hypothesis that I have, or cytomegalovirus or Epstein-Barr virus. Like, there's so many different chronic viral infections. Sometimes they're affecting the nerves and mimicking, multiple sclerosis. Sometimes they're affecting the joints and mimicking autoimmune disorders. And I think it's important to evaluate to see if you can make a difference in interstitial cystitis. So how do you make a difference? Well, you got to stimulate the immune system. And this is something where functional medicine excels. In alternative medicine, he basically says that let's use vitamin C and zinc, which has a place in it. But medicine really doesn't know how to stimulate the immune system for these subclinical viral infections. That's the thymus gland and the spleen. There's also some considerations for lubricating the mucous membranes using vitamin A is a really good one, and also using lipotrophic B vitamins. Those are the fat-soluble B vitamins that really are helpful in chronic nerve conditions. Collectively, in the old-school terminology, it's called vitamin G. So vitamin A helps to lubricate mucous membranes. The best source of it is your knife and fork, particularly carrots. There's some in spinach. There's some in squash. The beta-carotene molecules are really helpful. The beta-carotene that you get from natural foods. I like to supplement with any type of mucous membrane concern with about 10,000 units of vitamin A. That's what I've used for me. I've seen some outcomes with that. And also using a ground up cow bladder extract. They call that proteomorphogen therapy. It's thought that it gives the DNA blueprint for patients to reconstruct bladder. Now, again, that statement hasn't approved by the FDA. This is an experience that my grandfather taught my dad and my dad taught me with these conditions. There's also an enzyme called arginase, which cleans the kidney tree from the kidney to the ureter to the bladder to the urethra and then exits the body. I like using arginase as a detoxifier for the entire kidney tree. Again, getting things to stimulate the immune system. Now, from an advanced therapy standpoint, I really like using 3 different ways that are intravenous treatments for interstitial cystitis. One of them is to use high-dose vitamin C therapy, but different than most people think it is. So vitamin C therapy helps to donate electrons to the body and stimulate the immune system, but I don't want the acidity component from ascorbic acid. So the way around that for these chronic complicated cases is to use vitamin C and mix it with sodium bicarbonate therapy and make sodium ascorbate therapy. So you get the benefits of the vitamin C therapy without the acidity component, and I've seen some good outcomes with that. And by the way, when I say good outcomes, this is something that has a lot of different causes and contributing factors. It's not easy. It's not hey, you take 2 cups of flour, an egg, some baking soda, put it in the oven for 350 degrees, and out comes, a cake. It's not like that at all. You have to individualize the treatment. That being said, in addition to the sodium ascorbate therapy, something that most people aren't aware of, but that is really helpful in these cases, and not all cases, some cases, is using dimethyl sulfur oxide therapy, which is refined tree sap. So what refined tree sap is it basically it is refined plant blood that's a universal softener. And when I say blood, it's the active component of some of the basically plant components. It is helpful for this. There's actually FDA approval for using Dmso, using a catheterization technique. It helps to soften and has some circulation components that are really helpful for bladder conditions. Now, that's not something that I do. I know some providers that do it that way. I like to add the Dmso into the infusion component because it helps to transport molecules across different membranes and some other things, at least in my experience. Now, there's a downside to Dmso therapy, but it's minor, in that because it has a sulfur molecule attached to it, what it does is it has a tendency to people to outgas or smell like garlic or cream corn. It's a lot of times what people describe that. Now, the patient never, ever receives this. Like, they don't know because it comes in 1 molecule at a time, but I've got an excellent scientific write-up on Dmso therapy. The last thing that I want people to be aware of is a treatment that started in Germany in the 1940s that is really a nice thing to try without any downside, and they call it ultraviolet blood irradiation therapy. It's really helpful for moderate to advanced infections, and there's even some good clinical evidence that helps terminal infections, and that's by extracting a certain unit of blood, mixing it with ozone therapy, running it past an ultraviolet tube system back into the body. It was outlined by Dr. Robert Rowan about 25 years ago in an article called The Cure That Time Forgot, but an amazing, effective way to help people to just stimulate their immune system a little differently. Has some really nice anti-inflammatory effects. Now, the last thing that I want to talk about as far as what you can do for interstitial cystitis is to help reprogram the nerves. Many times in accidents, injuries, trauma, surgery, or even infections, the nervous system has a nerve memory system that is telling the central nervous system in the brain, I heard, or something's off. This can happen with a rodeo or a rancher guy that's out practicing, gets a rope caught around his finger, the cow takes off, pulls his finger off, and he'll come into the office and say, Dr. West, my finger is killing me. We call that phantom limb syndrome. It can happen with surgery cases. Phantom gallbladder syndrome is another common one. And then there's an awful condition called post-herpetic neuralgia, where you can have an injured nerve following a shingles infection that can feel just like you're having an active infection, even though the infection's gone. That's a nerve injury that is telling the central nervous system, I hurt. I think this is important to understand in the condition of interstitial cystitis. Now, the way that you help to reset that is to do a therapy called neural therapy. It was discovered by Dr. Huneke in about 1920, so we're 100 years, and it was publicized by a father-son combination named Dosch. Matthias Dosch was the original author of the Manual of Neural Therapy. And basically, to summarize his big book, it says that when people are created, they get a genetic component from their mom and their dad, they get together, the spark of life happens, and what occurs is those cells supposed to divide, then they roll on top of each other and they begin the notochord, or the spinal cord development. Off of that spinal cord, there's 3 layers that develop: the ectoderm, the endoderm, and the mesoderm. So something creates muscles, something that creates organs, and the brain, the nerves, and the skin all come from the same developmental layer, which means they have the same wiring or input system. Now, on the bladder, the nerve that comes out of the bladder comes from the brain to the central nervous system. It basically goes out through the organs and the tissues and the muscles out to the skin over the bladder area. If you work on the skin, it has the potential, and it doesn't work every time, but there's no downside of trying this, is it helps to rewire the organs underneath to the central nervous system back to the brain. This technique is called neural therapy. It's been around for a long time. You used a glycolized ether of paraminobenzoic acid, which is in the B vitamin family. What it does is it causes the nerves to hyperpolarize, to repolarize, and to depolarize. So for complex regional pain syndrome, for interstitial cystitis, for unfortunate surgical outcomes where there's a lot of scar tissue, and for post-herpetic neuralgia, this is a consideration. There's very little downside. How you do this is you treat the skin above the organ or affected area like little mosquito bites. It's not an invasive procedure. And when you get that nerve segment to open and close and reset, sometimes you can reset these problems. And you know what the neat thing about it is, if it doesn't work, the patient's not any worse. The risk to reward factor is significant. So I have an article on neural therapy. There's one on ultraviolet bloody radiation therapy. There's one on Dmso. There's Dr. Levy's book on 1,200 scientific articles of how vitamin C helps with different conditions, infections, toxins, and degenerative disease. And there's also a lot of consideration for different vitamin A, vitamins Inc., astragalus, andrographis, slippery elm, burdock root. All of these are considerations in the treatment and for interstitial cystitis. How you take care of this is you have to be willing to treat the patient, not the disease. That means as you're doing your workups, you got to treat the imbalances, get everybody imbalanced. That's the only way that you can help this condition. And sometimes you can help people, and sometimes you can't. I don't want to sugarcoat it for anybody. When I have people call the office and ask about this, I'm always willing to try, but it is not an easy cakewalk. Not impossible, but you've got to really be able to think outside the box, to listen to the patient, to look at the numbers, and to try different interventions. That's a real quick summary of a difficult condition, interstitial cystitis. And it's certainly worth knowing about those things, particularly when people have been diagnosed and then they've been treated inside the medical system, and the medical system has not been able to get the outcomes that the patient is aware of, would like. There's no perfect treatment for any condition. Certainly these are worth trying. I'm Dr. West with our clinical shorts on interstitial cystitis. If you want to work with me, you can go right to our website, westcliniconline.com, click the schedule button. It puts you inside of the system that we can help you. We help people across the street and across the country, literally from every continent, every state, either putting together protocols that we can send to them, designing protocols to work with a doctor in their area, or we have a lot of people that will do the migration to my favorite little town, which is my hometown in Idaho. So just because you're far away, I think that there are different ways and considerations that we can help you. Remember, I do a show every Wednesday night on a clinical topic, and also every Thursday night on a patient success story. I'm Dr. West, and we'll see you on the next